We've recently announced that we're partnering with Henry Ford Health System to improve access, affordability, and outcomes for healthcare patients. Healthcare is one of the most important building blocks of a strong community, and together, MSU and Henry Ford Health System will focus on addressing basic unmet needs that allow communities to thrive while also addressing disparities. Education, research, primary and complex acute care are key areas of the collaboration. This is the first step, and many details are still to be worked out. But what's the importance of this partnership, and why now?
So thank you, Russ, and you described it very well. It's we're worked on a letter of intent essentially between the Henry Ford Hospital System and Michigan State University to really develop a deep partnership in some areas we think are incredibly important. So those would include, of course, education, our medical schools, particularly our College of Human Medicine is very interested in working with Henry Ford to develop an actual site where we could do training of students and physicians. It's very important from a research point of view. We believe we have a number of areas where we can collaborate on research, particularly, obviously, research in biomedical areas, but also they would love access to some of our social scientists, to some of our public health experts who they think could be helpful with them as well. So that's an important way we could come together. And finally, it's in clinical care. One of the challenges we've had at Michigan State University is to find a partner. We have some good partners in Spectrum and Sparrow and McLaren, but to find a partner who really is interested in a deeper partnership and one that ties our interests maybe more deeply than we've had with others. And I think this is something we're excited about that we can develop with Henry Ford. We think they are a great partner. Their outreach, particularly in Southeast Michigan, is extraordinary. They were one of the leading groups taking care of patients with COVID-19. And I think it ties in very well with the kind of work we're doing with Flint, with our greater engagement in public health throughout the state. I think this partnership gives us the opportunity to increase our clinical outreach to areas that could use our help, not just in medicine, but in public health and other areas where we can make a difference. So, healthcare is more and more holistic. It's about prevention. It's about reducing health disparities. And Henry Ford and Michigan State University working together, I think, could develop a partnership that could really make a difference to the state of Michigan in a number of different ways. So still a letter of intent at this point in time as we work through details of how we would bring this partnership together. So I don't want to overpromise because we're working together to get this done. But there's great enthusiasm on both sides. I think each partner brings to the table a number of great strengths, and I think we could do some wonderful things together, and we just need to get it figured out.
Will there be more higher education healthcare partnerships in the future, do you think, and why?
I think, this is very important for us. I think, again, we have a number of talents, and being at the university we are, when we talk about our healthcare experiences and expertise, we also can draw upon our great biomedical engineers, our College of Nursing, our College of Osteopathic Medicine. We have so many resources that we bring into these discussions that I think we'll look for more partnerships if we can find them.